Thank you, Mr. President. Healthcare access is on the line here in Georgia and across America. Georgians are going bankrupt or giving up trying to find health insurance entirely, while Republicans in Washington play politics, refusing to extend the Affordable Care Act tax credits. 200,000 Georgians have already lost health insurance in the last month. 1.5 million Georgians could either lose insurance or see their premiums double or triple in light of Congress throwing Americans under the bus. Here in Georgia, our hospitals can lose $1.6 billion in revenue, deepening the dire financial situation that many are already in. With all of the chaos coming from Washington, it's more important than ever for our state government and leaders to step in to defend Georgians. Senate Democrats have proposed solutions to this crisis. SB 379 would create a state-based health insurance affordability program. This program would lower costs for those up to 400% of the federal poverty line and provide free health care for those up to 200%. Georgia Democrats have been fighting for years to expand Medicaid. SB 380 is still the best path forward to ensuring that millions of people can afford to see a doctor. We have got the third highest number of uninsured people in the nation, and it's getting worse. Here are just a couple recent stories. Teresa Acosta, a single mom of 3, saw her premium jump from $80 in December to $520 a month in January. Her son has type 1 diabetes, requires regular care, and she's tied in knots and kept up at night wondering how she will be able to continue to get him the health care he needs. A small business owner in Dahlonega reported that her monthly premium was $97 before the subsidies were removed, and now it is, instead of $97 a month, it is a whopping $1,100 a month. The solutions are there, but Republicans are sitting on their hands trying to pretend that the crisis doesn't exist. This is not a crisis that you can ignore. People understand what is going on when their premiums go up thousands of percent a month. We might hear, wait, we have expanded Medicaid for those who could jump through the hoops that have been laid out. The thing is that the Pathways program from the jump has been so purposely contorted with endless paperwork and other requirements that only 6% of those who could have gotten insured have managed to cut through the thicket and get the insurance. Meanwhile, that program has wasted tens of millions of dollars to insure a tiny fraction of people. Only 30% of the money has actually gone to patient care or to doctors. 70% has gone to administrative expenses. So essentially, it has become a jobs program for paper pushers. And what is the point in that? We should have expanded Medicaid a dozen years ago, where we could have insured a whole lot more people at a lot lower cost. The Republicans in Washington just added a work requirement, and they still pay 90%. So what's the objection now? I suggest that it's that Georgia Republicans are not yet willing to admit that Pathways has been a failure. We've been told that access has been a great success, and we don't clean up Washington's messes. This has left Georgians asking, if it's not the responsibility of Republicans in Washington to fix this crisis, and it's not the responsibility of Republicans in Georgia to fix it, then who is going to lead on this problem and fix it and lower costs for Georgians? I would suggest to you that it is going to have to be Democrats. Democrats have always led on health care. Democrats created Medicare, Medicaid, and the Affordable Care Act. It's clear to Georgians that Democratic leadership is needed on this issue once again. Thank you. I yield the well.